My name is Rebecca Welch, and I'm a student at Florida State University in the Doctor of Nursing Practice program. If I can have just a few minutes of your time, I'd like to share some important information with you. Information that could help your organization provide support for your nurses and reduce attrition. Working in healthcare, you've likely experienced the nursing shortage firsthand. In 2019, it was estimated that the U.S. would be in need of 2.3 million more nurses by 2025. Unfortunately, the COVID-19 pandemic has turned what was an enormous challenge into a near crisis. Due to the overwhelming physical and emotional demands placed on our nurses by the pandemic, we've lost over 20% of our nurses in just over 2 years, and many of those nurses were our most experienced. Characterized by physical and mental exhaustion, detachment, cynicism, withdrawal, and poor work performance, burnout is generally related to overwhelming physical and psychological stress in the workplace. Although the numbers are difficult to quantify precisely, a significant proportion of nurse attrition results from burnout. Studies completed in other countries suggest that physical pain is a significant contributor to burnout. However, physical pain continues to be overlooked by researchers and healthcare organizations as a cause of burnout, especially in the United States. A recent study of 12,000 nurses in the U.S. revealed that COVID-19 has dramatically increased burnout symptoms. Nurses surveyed stated that the system has failed them due to shortages of support staff, personal protective equipment, and other crucial supplies. Since the pandemic began, nurses have been coping with compassion fatigue, psychological trauma, overwhelming workloads, extra hours, staff and supply shortages, and the physical strain of working 12-hour shifts dressed in stifling PPE. The survey also revealed that 4.3% of nurses intend to leave the profession as a direct result of burnout from the COVID-19 epidemic. If the results of the survey are generalized to the entire U.S. nursing population, it means that more than 2 million registered nurses and licensed practical nurses are potentially planning to leave the profession as a result of inadequate support during the COVID-19 pandemic. Nursing schools have responded to the nursing shortage by recruiting and graduating more nurses every year, but even so, the nursing shortage is projected to worsen. So it's vital that we retain as many nurses as we possibly can. Even prior to the pandemic, it was estimated that the average hospital lost between $3.6 and $6.5 million per year due to nurse turnover, over $40,000 per nurse. Maybe your organization has enough nurses and you aren't feeling the impact of the shortage yet, but even so, the turnover costs can be enormous. If I could convince you to invest just a fraction of that money into interventions to retain your nurses, I believe that your organization could save money, your nurses could feel more valued, patient satisfaction could increase, medical errors could decrease, your nurse turnover rate could decrease, and you would be doing your part to retain as many nurses as possible. As part of the DNP program that I'm finishing at FSU, I just completed a new research study of Florida's nurses. It included LPNs, RNs, and ARNPs. The study focused on musculoskeletal pain and burnout in nurses. You'll find the full research report in the email you received. 763 nurses participated in the electronic survey, which utilized the Nordic Musculoskeletal Questionnaire and the Maslow Burnout Inventory, both well-validated tools. The literature review found that similar research studies in Japan, Turkey, China, Switzerland, and Saudi Arabia revealed that between 50% and 80% of nurses experience some form of musculoskeletal pain. Our study found nearly the same incidence. Of the 763 respondents, 53% of Florida nurses had musculoskeletal pain in the past year, which had interfered with their normal activities, and 47% had consulted a physician about their pain. 78% of respondents reported experiencing physical pain in the past week. Our research also found that emotional exhaustion on the Maslow Burnout Inventory was extremely high overall, with depersonalization at a moderate level, but personal accomplishment remaining high. which indicates that despite being emotionally exhausted, nurses still find a sense of accomplishment and fulfillment in nursing. Further analysis of the data in our study showed that pain in any of the 4 categories of the Nordic Musculoskeletal Questionnaire correlated with high levels of emotional exhaustion on the MASAC burnout inventory. The highest incidence of emotional exhaustion was among nurses who had pain during the past year that prevented their normal activities, 61% versus 18% moderate and 21% low. Respondents who had consulted a physician about their musculoskeletal pain in the past year also had a high incidence of emotional exhaustion, 55% versus 21% moderate and 24% low. Among those who had experienced pain in the past 7 days, 59% had a high rate of emotional exhaustion, with 19% moderate and 22% low. Those reporting no musculoskeletal pain in the past year had a much lower rate of emotional exhaustion, with only 23% high, 17% moderate, and 60% low. As you can see in this chart, that's a significant difference. It was interesting to note that LPNs, 65% of LPNs, and 57% of RNs were more likely to have a high level of emotional exhaustion than ARNPs, who had 46%. Emotional exhaustion was also found to be highest in ages 19 to 30, 80%, and went down with increasing age to 33% among those 61 years and older. Inpatient nurses also had a higher incidence of emotional exhaustion, 62% for inpatient nurses versus 50% outpatient. Our study found that shift length is an important variable in both musculoskeletal pain and burnout symptoms. 70% of responding nurses working more than 12 hours per shift were found to have a high level of emotional exhaustion. This is supported by a number of other research studies from around the world indicating that excessive workloads are a significant factor, not only in musculoskeletal pain, but also in burnout symptoms. For example, a 2018 study found that low staffing levels contributed to emotional and physical fatigue in healthcare workers, which are important factors in burnout. Similarly, another study in 2019 linked excessive workloads directly with higher burnout rates in healthcare workers. Another interesting finding was that APRNs have less difficulty than RNs and LPNs, with not only emotional exhaustion, but musculoskeletal pain as well. As the role changes from LPN to RN to APRN, of course, the expected duties and physical demands change as well. Our study data appear to indicate that LPNs have the highest levels of physical pain and emotional exhaustion, and APRNs the lowest among Florida nurses. So what can you and I do? How can we support our nurses experiencing musculoskeletal pain and/or emotional exhaustion? What can we do to reduce attrition of our valuable nurses? The nurses participating in our study were very clear about the interventions that they believe would help them to remain in their jobs. The most important choice was better ergonomics, such as the use of ergonomic chairs, keyboards, and lighter medication cards. Responses from both the pre-filled choices and the written-in suggestions selected increased staffing, lower nurse-patient ratios, more aides, and more nurses. I found it especially striking that administration and management support was the third most popular write-in suggestion. Other interventions chosen included the use of lift teams in hospital units, shorter shifts, and on-site massage therapy. Burnout is a complex phenomenon influenced by many factors. Research has already shown that emotional exhaustion plays a role in burnout and attrition of nurses. This study provides evidence that musculoskeletal pain may be another important factor in burnout in Florida's nurses. However, although musculoskeletal pain and the emotional exhaustion component of burnout were highly correlated in our study, it is difficult to draw exact conclusions. Many research studies have demonstrated a strong correlation between mental health, musculoskeletal pain, and burnout in healthcare workers. In one such mixed method study, research examined the cause and effect of burnout in hospital RNs in U.S. hospitals and found that organizational characteristics included excessive workloads, poor work environment, staff shortages, and low RN to patient ratio. Unfortunately, determining whether physical pain contributed to emotional exhaustion in participants is beyond the scope of this study. I can only speculate that they are causally linked and very likely influence each other. It is common medical knowledge that depression can cause physical pain and that chronic physical pain can cause depression. I believe that it is much the same relationship between physical pain and burnout. This study adds some supporting evidence to this hypothesis, but there is more research to be done on this topic another day. If you would like to address the issues of musculoskeletal pain and burnout in your nurses, you'll find some helpful flyers in the email you received. The first is a flyer that you can distribute to your nurses to encourage conversation about physical pain and burnout. You can edit that flyer easily in Microsoft Word. Also included are a list of available resources, one for nurses experiencing musculoskeletal pain and the other for those experiencing burnout symptoms. Each packet contains links to free peer support groups for nurses, organizations offering toolkits and information, recommended books on the subject, links to low-cost assistive devices for pain, and more. According to our study and to the international research on musculoskeletal pain and burnout, it's safe to say that physical pain is an enormous problem in our nurses here in Florida. Much of the focus on preventing burnout and attrition in nurses has been on the psychological aspects of nursing. And while that is certainly an important part of the burnout puzzle, physical pain, whether it contributes to burnout or not, is something often overlooked and ignored. Many nurses never even let their employers know that they are experiencing physical pain, for fear of missing opportunities for advancement or for fear of being suspect should a pain medication go missing. I want to change this, and we've made it past the first step, awareness. You now know the scope and importance of the problem, and it's up to you to take that second step. Please use the flyer included in the email you received to start a conversation with your nurses. Our nurses are arguably the most important aspect of quality medical care. Let them know they are valued by acknowledging their physical pain. And feel free to contact if I can help in any way possible. To wrap up, I want to leave you with some of the benefits of reducing physical pain in nurses. By reducing pain, you can have happier nurses who feel valued by their employers, higher quality patient care and patient satisfaction, fewer PTO days used by nurses, less use of short-term family medical leave, reduced usage of opioid pain medications and opioid dependence by nurses, fewer medical errors due to reduction in pain-related insomnia and depression, possibly reduced burnout in nurses and resulting attrition, fewer workers' compensation claims, fewer pain-related employee lawsuits, lower healthcare expenditures for the treatment of pain, and reduced nurse turnover, which can save your organization a lot of money. Thank you so much for your time.